I will tell a little bit about urinary tract infection and vesicouretic reflux. Now, previously, we used to evaluate the urinary tract infections very seriously because we want to look for a condition called vesicouretic reflux, which is basically the urine going back from bladder to the kidneys. Over the years, what has happened is the stress on identifying the reflux is becoming less and less because the end point which all the research work considered was renal scarring. So they all felt that renal scarring is not related to the UTIs or reflux. So we don't even have to find the reflux. That's the kind of approach we are heading to. In fact, the latest ISPN guidelines just mention an ultrasound as a screening test even in children with the recurrent febrile UTIs. So as far as the individual patient is concerned, for them every hospitalization means loss of school for the children, loss of work for the parent. So we have to identify the reflux. We have to make sure that the child does not go to repeated hospitalization or lose weight because of the repeated infections. So just doing an ultrasound and saying that reflux possibly is not there is not enough, because ultrasound is a very insensitive test to pick up a reflux. So we recommend a proper evaluation, particularly in children with a recurrent febrile urinary tract infection with a DMSA scan well after the infection is controlled. Probably 3 to 4 months after the urinary tract infection, we should do a DMSA scan to look for scarring. And if there is a scarring, then we have to do an MCU or VCUG to ensure that the reflux is not missed. So this is important because, if we feel that stopping recurrent hospitalizations and recurrent urine infections is going to reduce the number of scars on an already existing kidney, then that is worthwhile. So the end point on the results have to be taken in the context. Just a research was saying that the scars do not alter. It doesn't make sense. If you are going to stop recurrent urinary tract infections, definitely you are going to reduce the number of scars on the top of already existing scars. So I think it's important to evaluate children with recurrent urine infection, find the reflex, and if necessary, treat it and stop it also.